Um, my name's Raf. I'm 26 years old. I'm from North London. I'm currently a student on the Mental Health Recovery and Social Inclusion Master's Programme at the University of Hertfordshire. I'm also the Expert by Experience Lead for Signet Healthcare, and my role is to ensure that service users have a voice at every level of the organisation, at every 136 of our services nationally. My corporate governance director kind of suggested that I should go for some education, because I always talk about, because of my kind of upbringing, I never really had an opportunity to pursue any education. And in my culture, education is really important. So there was the whole kind of family pressure, and also the kind of society that we live in. I feel that education is very valued. It's like there's a kind of pathway, isn't it, from school to university and then into employment. And that's something that I kind of missed out on. The admissions policy was very easy, it was very simple. It was very straightforward in terms of having the right support and being able to fill out any applications. You've got the online team there, but you've also got specific individuals that you can contact if you got stuck or anything like that. But it was very simple, considering that it's something I hadn't done before in particular. I thought, to be honest, I thought the task was going to be a lot more difficult. Coming onto a master's program without any kind of formal education or qualifications, not even GCSEs or A levels, let alone undergrads. It was very, anxiety-inducing to kind of be given a task to do. But the task was fairly reasonable, and it also gave me the opportunity to decide whether this is something I want to pursue. And at the same time, it probably gave the university the opportunity to be able to see my own skills and if I'm able to be a candidate on the course. I think what was really interesting about the course was learning about the benefits of some of the things that I already knew were good. For example, peer support workers. I always knew peer support workers were the right thing to do, but I didn't actually know there was research that demonstrated that people actually spend less bed days, for instance, in services as a result of using peer support workers. And just having that knowledge of the impact of the work that we're doing. We were doing this work for quite a few years, experts by experience, lived experience, peer support. Recovery as a whole isn't something that's specifically new, but I guess I lacked that knowledge about the impact that I was actually having and the awareness that was out there and the research that had already taken place. So it's been very illuminating. I often say that the Mental Health Recovery and Social Inclusion course is a course that lives up to its name, because it really does promote social inclusion. It does promote recovery. It gives someone meaning. It gives someone purpose. Someone something to wake up for. Obviously you've got the bragging rights of saying you're doing a master's, but it's a community thing as well. And going back to what I was talking about in terms of culture, it's really given my family something to be proud of. But more importantly, it's given me a lot of insight into the theory of a lot of my practical experiences, both the lived experience element and the professional experience element. The theory and the kind of why behind it was always missing, and it's really filled in that gap. A lot of what we've looked at on the course isn't only specifically about mental health. Learning disabilities, substance misuse, we look at things like homelessness, and I guess the social inclusion element really brings a lot of other subjects out aside from solely just mental health, which I think is positive because it gives us the opportunity to see how societal issues are inextricably linked to one another. I'm most proud of being able to get onto a master's program, to be honest with you. I mean, getting employment wasn't as difficult that I thought. Kind of my own recovery wasn't as difficult as I thought, although it was all very difficult, I can assure you that. But being able to get onto a master's program without having any kind of formal qualifications, being able to get this far and getting the kind of marks that I've been able to get has really been not just a confidence booster, but it's also taught me so much and been able to improve my own practice outside of the university, not only into my workplace, but also into my life. We often forget that a lot of what we learn influences our decisions and the way we look at things, even outside of studying or outside of the workplace, in our personal lives. And that's really important for me. I think a lot of the time when people are considering a career in mental health, it's because they may actually have a link to mental health, whether it's interest, or whether it's a friend or a family member or an experience that they may have had. Or it could just be, you know, that you're a nice person, that you want to help people. I'll say it's not an industry that you want to come into if you want to become a billionaire. It's an industry that you want to come into where you want to help people or you want to make a difference. And it's about finding what you're passionate about and actually leading onto that. And this course gives you the opportunity to really be able to think, what do I want to do? Could I become a psychiatrist? Could I become a nurse? Could I go and work in a community service? Could I go into academia? It really gives you the opportunity to really explore what you want to do.